Hospitals, especially in developing countries, provide more than just medical care for the ill. Their role in preventive medicine is essential. They concentrate an enormous financial investment in diagnostic and treatment equipment, high-tech laboratories and blood banks, and they carry out research on health and medical issues. Hospitals clearly have great social, economic, and political value. The complexity of a hospital can be seen from its daily activity. In many countries, an average tertiary care public hospital operates 24 hours a day. There are many specialties and hundreds of beds. The occupancy rate is typically over 90%. Counting patients, visitors, administrative and health staff, a hospital could house more than 1,000 people at any one time. Clearly, this calls for an enormous level of organization and logistic support. Running this hospital requires basic services such as water, sanitation, electricity, and communications. A hospital also houses the radiological, nuclear, chemical, and combustible materials needed to provide specialized services. This complex structure can be affected by unanticipated events, one of which is natural disaster. In Latin America and the Caribbean, more than 8,000 hospitals, that is 50% of the existing stock, are located in areas that are at high risk for natural disasters. According to the United Nations Economic Commission for Latin America and the Caribbean, in the past 25 years, direct losses to health facilities caused by natural disasters in the region totaled over $4 billion. The Hyogo Framework for Action, adopted at the Second World Conference on Disaster Reduction in January 2005, called on member states to ensure that new hospitals are built with a level of resilience that strengthens their capacity to remain functional in disaster situations. What is a safe hospital? In a safe hospital, services continue to be accessible and function to their maximum capacity immediately following an emergency, disaster, or other crisis. The continued performance of a hospital protects the people inside the building, the medical care during and after the event, and the investment in the facility. Latin American and Caribbean authorities should understand that with the expertise and resources existing in their countries, it is possible to have safe hospitals. This is both a social and economic necessity. Building a new hospital that integrates disaster risk reduction measures can cost the same as building a vulnerable one. The cost of retrofitting an existing hospital can require an investment of 8% to 15% of its original cost. Rebuilding the same hospital after a disaster requires an investment that exceeds 100% of the total original cost. But how can countries worldwide realize the goal of having safe hospitals? Political will is the first requirement. Policies and regulations about having hospitals that can survive disasters will be the basis for preparing national standards, codes, and procedures needed to ensure that a program is in place to protect health facilities. The execution of a Safe Hospitals initiative should be directed at new investments in health and at reducing vulnerability in existing structures. To make sure that a new construction has low vulnerability to a natural disaster, the building or expansion must be located in a safe site, and proper building codes and technical specifications must be applied during construction. Qualified professionals must participate in and assess the project. In the case of existing buildings, decisions about which facilities have the greatest need to incorporate risk reduction measures will be made based on an analysis of resources and the performance of the health network. These measures should guarantee the continuity of basic services, protect medical equipment and supplies, and provide stability for architectural elements. It is important to develop hospital disaster plans, prepare and train personnel for emergencies, provide signs in the facility, and carry out a plan for preventive maintenance in the hospital. It is essential to include standards for a safe hospital in the process of hospital accreditation and certification. Several countries in Latin America and the Caribbean have successfully carried out measures to mitigate against damage caused by natural disasters in their health facilities. Health facilities are symbols of social progress and are essential for economic development. Vulnerability of health infrastructure must be reduced. Otherwise, the UN Millennium Development Goals and the goals set out in the Declaration of Hyogo to reduce disaster vulnerability will continue to be out of reach. There must be guarantees that all new investments in health include aspects of disaster mitigation and prevention, and that existing facilities will reduce their vulnerability to ensure that they can continue to perform when they are most needed. This is the responsibility of many sectors and represents a basic political and social obligation. To achieve a safer world, it is essential to build, prepare, and safeguard safe hospitals.